Okay. So hi, evening friends, evening everybody, bache, evening everybody. So I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS MAMC, MD Pathology, Resident Hemat-Oncology, AIMS Delhi. So let us start with our pathology FMG recall. Now, before I even go further, देखो अपना पेपर इज़ डन. इस टाइम पे बिल्कुल ज़्यादा चिंता करने की ज़रूरत नहीं है. आई एम श्योर you would have attempted it well. Overall, the paper was what we have been told, and it is a very interactive session. So please write more. Firstly, अगर कोई भी ऑप्शन, आई हैव अबाउट 10 to 12 पैथोलॉजी क्वेश्चंस विद मी. अगर कोई भी क्वेश्चन ऐसा है जिसमें यू वांट टू चेंज द ऑप्शंस या वट एवर, दिस इज द फर्स्ट रिकॉल वी आर हैविंग, सो प्लीज डू नॉट हेजिटेट टू राइट इट इन चैट. अच्छा, अपना ओवरऑल पेपर कैसा था? I have talked with 6-7 students till now, and bache, they told me that the overall the paper was moderate. It wasn't extremely on the easy side. Also, it was moderate. With paper 1 actually being slightly tougher, it was moderate to tough. Whereas the clinical paper जो हम लोग usually expect करते हैं कि moderate side में जाएगा, that was on the जो थोड़ा सा tougher side में जाएगा, that was moderate. So this is what I have been told. Before I go further, you tell me अपना पेपर कैसा गया. Please write it in chat box or whatever, कि ताकि हम लोगों को पता रहे कि this session interactive. Overall कैसा feel आ रहा है after giving the paper. I'll keep on discussing the questions also side by side with you. Majority of the questions, देखो, I just had a 2-hour recall session of pathology, out of which genetics पे इतना ज़्यादा focus session में भी किया था. Same thing that was asked in the paper. Which syndrome is associated with mutation in FBN1? Remember, FBN1 gene mutation, protein fibrillin 1, that is Marfan syndrome. Paper में, I guess the image was not given to you. What was given? Yes, it's working fine. So what was given was a written MCQ. इसमें अगर कुछ भी अपन को ऐड करना है, but this was what was the bottom line that was given. FBN1 gene mutation, chromosome 15, protein fibrillin 1, Marfan syndrome, autosomal dominant in nature. This recall session is not only for the students who gave the paper to this time, but which is same topic. Similar questions are repeated in our next paper also. So it is going to be extremely beneficial, no doubt. Next question. Newborn child presented to the OPD with a single palmar crease, that is single simian crease on palms. I need not even tell you कि जैसे ही ऐसा कुछ भी आता है, we are referring to Down syndrome. Guys, I guess there is slight background noise. Just give me 1 second. Let me take care of this. Just give me a sec. Okay. So coming back to this. So question number 1, see, Arvind, you were right. Second, the minute we have a single palmar crease that we are talking about Down syndrome. Downs, remember, most common genetic cause of mental retardation, abundant neck skin, epicanthic folds, flat facial profile with a single transverse simian crease. That was Downs. I know, itna easy. Acha, was there any change in the language of the question? With respect to pathology, this is the recall those that I have received. So if there is any change in language of the question, please do write it in the chat box. फिर and paper बिल्कुल easy नहीं था दोस्त. Paper, especially paper 1 was slightly on the tougher side. Clinical वाला paper was moderate. Next was chromosome 5p deletion, that is Cry-do-chat syndrome. When we are talking of Prader-Willi versus Angelman syndrome, remember, those are the diseases associated with genomic imprinting, whereas Turner syndrome is 45XO. तो अगर हमें 5p deletion नहीं भी पता था, what is left by default is Cry-do-chat syndrome. Next, recent PYQ, I guess this was last time's PYQ. A male presented with gynecomastia, tall stature, small testis, infertility. That is a male in which there were reduced secondary sexual characteristics. Were reduced. This was a similar question, that is a couple who is married for past 5 years and is trying to conceive. The female is normal, but male is suffering from gynecomastia, tall stature, atrophy and all. This was Klinefelter syndrome. where it is associated with 47XXY, chromosome abnormality 47XXY, that is Klinefelters. नेक्स्ट क्वेश्चन KF रिंग किस में मिलता है? केसर फ्लेशर रिंग, KF रिंग, Wilson's disease. KF ring, we see the presence of deposition of copper in Descemet's membrane in limbus of cornea. KF ring, Wilson's disease. इसमें recent PYQ also was ATP7B gene mutation, chromosome 13, Wilson's. ATP7A gene mutation, Menkes disease. ATP7B gene mutation, Wilson's disease. Wilson's. Next, again a topic which is focused a lot: blackish pigmentation on the lips with intestinal polyp. Intestinal polyp, the location most commonly is the duodenum, seen usually in children. That is, if you have a history of a 11-year male child presenting to OPD with intestinal polyps in duodenum, duodenum और jejunum भी कर सकते हैं इसको, in presenting with intestinal polyps in jejunum with blackish pigmentation around the lips, that is Peutz-Jeghers syndrome. Peutz-Jeghers syndrome associated with STK11 gene mutation. अब तक अपना path कैसा जा रहा है? Were you able to mark these right? I am genuinely curious about this. Were you able to mark these right, या we went slightly wrong in few of these questions? Next, Burkitt's lymphoma के साथ translocation पूछी गई थी. Burkitt's lymphoma, a recent image based PYQ was asked, that is Taris का appearance भी पूछा गया था. Next, another recent PYQ in our FMGE exam only was gene mutation associated. It is c-Myc, which is a proto-oncogene. c-Myc proto-oncogene mutation. Burkitt's lymphoma, translocation 814. You know this. अच्छा, questions यही थे. Hussein, I guess you gave the paper. Were these the exact language of the questions? There was a slight modification with this being the bottom line of the question. Please tell me this also, because it will help in framing the exact questions for a better recall. Questions usually ऐसे ही थे अपने. And last question था जिसमें smear from vesicular lesion showing the presence of multinucleated giant cells as seen in the image. That is Zank smear, HSV. Herpes, simplex virus, HSV. Zank smear दिया गया था with respect to HSV. Herpes, simplex virus. So these were with respect to the pathology. 4 line का question. Sharma ji, Vikas, this was the bottom line recall. Acha, you are just marking. Okay, fair enough. Vikas, when a recall is being done, especially on the same day, this is the bottom line. I 100% agree कि इसमें Burkitt's lymphoma की जगह 4 line का question ये हो सकता है. That is, the examiner can give you history of a young adult presenting to OPD with rapidly enlarging jaw mass. Young adult who is presenting to OPD with rapidly enlarging jaw mass. Was such a history given which is not related to food intake? That is a case of Burkitt's lymphoma. Or examiner can give you that it is on histopathological examination, Taris ka appearance was seen, or it was associated with c-Myc, that is a proto-oncogene mutation. Examiner can give you 3-4 pointers in the question. The bottom line remains that it was a case of Burkitt's lymphoma, and in the end translocation was asked. This is how, देखो, जब हम लोगों का इस सेशन का क्या टारगेट है कि ये टॉपिक्स पूछे गए थे, इन टॉपिक्स में दिस वाज द डायग्नोसिस एंड दिस वाज द आंसर टू बी मार्क्ड. दैट इज द होल पर्पस ऑफ आवर फर्स्ट रिकॉल टुडे. अब जैसे ये वाला क्वेश्चन है, you might have a history of 11-year-old child presenting to OPD with intestinal polyps in duodenum या in jejunum लिख दिया with hyperpigmentation around oral cavity and nasal mucosa. Which of the following is the most probable diagnosis? Peutz-Jeghers syndrome. उन्होंने ऐसे clinical history based diagnosis दे दिया. So this takes care of our first set of questions. अच्छा, इसमें we had one more question, that is an ovarian lesion जिसमें hair and teeth were seen in the histopathological section. इसमें a history of an ovarian mass was also there. So what is the most likely diagnosis? You have a history, a dirty looking ovary which has hair, teeth, skin and everything that is extruding out. That is, it is a case of mature teratoma. Done है दोस्तों, done है. So these were the first set of questions that we have, but one thing is certain, जैसा भी पेपर गया है इस टाइम पे ओवर थिंकिंग इज नॉट गोइंग टू हेल्प अस. सो बेस्टेस्ट ऑफ लक फॉर रिजल्ट्स, देर इज एब्सोल्युटली नो डाउट अबाउट इट. आई नो पेपर इतना सिंपल स्ट्रेट फॉरवर्ड नहीं था. द क्वेश्चंस वर लॉन्गर, इट वाज मॉडरेट टू टफ पेपर, बट हम लोग अपने ऊपर विश्वास रखेंगे, भगवान जी पे विश्वास रखेंगे एंड एवरीथिंग इज गोइंग टू वर्क आउट फाइन. डन है. So on this note, I'll be wrapping up this session. Take care.